Hello, folks. Join our community and stay up to date all the time with the ESTES Podcast Series. This activity is sponsored by the ESTES Education Committee. Stay with us. Stay with ESTES.
Welcome, folks. Today we are discussing a fascinating study on traumatic fractures of the sternum, focusing on their typical distribution and the need for refining the AO-OTA classification system.
That sounds intriguing. What are the key findings of this research regarding the prevalence and characteristics of sternal fractures?
Well, the study, a retrospective analysis of 116 patients with sternal fractures from a Level 1 trauma center, revealed that sternal fractures are rarely isolated injuries. In fact, only 30.2% of patients had an isolated sternal fracture. The majority, 63.8%, presented with additional fractures in the lateral chest wall, and a significant portion, 19%, had posterior chest wall injuries as well. Interestingly, there was a notable association with rib cartilage fractures in 24.1% of cases.
I see. So the sternum fracture is often part of a more extensive pattern of thoracic trauma. What about the distribution of fractures within the sternum itself?
Right. The study found that fractures were not evenly distributed across the sternum. The corpus sterni was the most frequently affected area, 60.4%, followed by the manubrium, 35.8%, and the xiphoid process, 3.7%. A significant number of patients, 14.7%, had fractures in more than one part of the sternum, often a combination of manubrium and corpus fractures.
That's a valuable observation. How did the researchers classify these fractures, and why is that important?
They used the AO-OTA classification system, categorizing fractures into A, B, and C types based on morphology. However, they found that this system needs improvement. The current system lacks sufficient detail, particularly regarding fracture lines and subtypes. The researchers proposed refinements to better capture the complexity of sternal fractures and their clinical implications. For example, they suggest subclassifying A-type fractures based on the direction of displacement, which could help infer the mechanism of injury and potential associated injuries.
That makes sense. Could you elaborate on the proposed refinements to the classification system?
Certainly. They propose more detailed descriptions of fracture lines in two planes, coronal and sagittal, and more precise naming of bony transitions. They also suggest subtyping based on the number of intercostal spaces involved and the direction of the fracture line, especially for B-type fractures, which are often associated with seatbelt injuries. This could help determine the accident mechanism and patient positioning during the trauma. They also noted that the current classification doesn't adequately address fractures involving the angulus sterni or the transition to the xiphoid process, areas that are clinically relevant.
So, the proposed changes aim for a more precise and clinically relevant classification. What about treatment implications? Does the classification influence treatment decisions?
Absolutely. The study highlights that treatment depends heavily on the fracture type and displacement. Non-displaced fractures are usually managed conservatively with pain control and respiratory physiotherapy. However, displaced fractures, particularly those with instability, often require surgical intervention using locking plate osteosynthesis. The location of the fracture also influences surgical planning, with different plate types and placement strategies being used depending on the area affected.
That's a crucial point. Are there any limitations to this study that you'd like to mention?
Yes, the study's main limitation is its single-center design. The findings need validation through larger, multi-center studies. Also, the analysis didn't fully capture the fracture progression in the sagittal plane across potential subgroups, and further research is needed to clarify the classification of A fractures that extend across intercostal spaces. The treatment recommendations are also based on a literature review that doesn't always specifically address the individual fracture types described in the study.
That's important context. So, in summary, this study provides valuable insights into the characteristics and management of sternal fractures, but further research is needed to refine the classification system and treatment guidelines.
Precisely. This research underscores the complexity of sternal fractures and the need for a more nuanced approach to classification and treatment. Thank you for joining us today, folks. We hope you found this discussion informative. Goodbye.